blood and increased chances for metastasis. But then I calmed down myself, thinking that it could not be cancer because there was no history of breast cancer in my family. So then I decided to, well, do the biopsy. And well, 2 days later, we received the pathology result and confirming that I had invasive ductal carcinoma. Obviously, well, it took me a while to process this news. I was in the exponential phase of my professional career, super excited, growing. I was the mom of these 2 wonderful kids. I had many plans. We were preparing to go to Disney World to celebrate Mateo's birthday. I was launching a big project also in Mexico, so I was not ready for cancer. It was really difficult to accept, for sure, as it has been the case for all of you. Well, regardless of that, well, I knew that I had to move quickly. So in the next 2 days, actually that same day, as soon as I got the results, I got my first visit with a surgeon oncologist. And then I got 2 extra more oncologists. I wanted to have different opinions. I got for first time my mammogram. I was 36 years old, so I was not at the age where the mammogram is indicated. So that happens until you are 40. I got also an ultrasound. And the 3 surgeons, as they explored me and my breast, the common consensus was that I needed radical mastectomy based on the pathology results and the clinical exploration. And obviously the mammogram confirmed that, well, I had a potentially malignant tumor on my left breast, but I had also some nodules on my right breast. And the recommendation was to have pathology analysis for both tissues. And something important that one of the oncologists said, he recommended to have a PET scan, a PET CT, in order to identify if I had metastases. And you know, things were just coming worse and worse as I was learning more things. And I was kind of shocked, like, what do you mean with metastases? This should be kind of, well, early. But anyway, so I was happy that, well, I got the test. He said before doing anything, it's important to get a PET CT to determine where is the tumor and if there is something outside of your breast. And well, I got the PET scan the next day. So it confirmed that it was localized, and actually it confirmed that it was multicentric. There were several nodules. And obviously, well, that was good news because it was just present in my left breast. So, well, the life was pulling me in another direction. So we canceled the trip to Disney World. And well, Mateo's birthday was on May 25th. And that was the date that I got scheduled for my surgery for the radical mastectomy. So we organized a birthday 2 days before my surgery just to make sure that we didn't miss Mateo's birthday and to also imprint some nice pictures and memories of his mom, because my worst fear was that I could, again, leave my kids without a mom. So we organized a beautiful party, and then on May 25th is that I got into the surgery room to get my mastectomy. Everything went well, except that day in the morning, I was expected to drop off Mateo to his daycare, the public daycare. I forgot totally that as soon kids turn 4 in Mexico, public health daycares don't accept them anymore. So I had to find another private daycare and ask them to keep my child, because I was going to the hospital to get a surgery. So they were extremely shocked, and well, they were supportive. But anyway, so I got into the surgery. And when I woke up of the anesthesia, my surgeon approached me and he told me 3 good news. So one is that the borders of the surgery are clean. Your tumor was kind of very well encapsulated. The second is that the sentinel lymph nodes are negative, which is great. There is no metastasis. So we have put the podcast to also give you chemotherapy because you are going to require chemotherapy, and this is going to help to spread the chemo as soon as it enters into your body, because otherwise through your veins it can burn your veins. And then, he said also that they put the tissue expander to initiate the reconstruction at some point, which I got extremely shocked because we never talked about that as we were preparing for the surgery. So I was upset. I asked him, who approved that? And he said, well, your husband during the surgery, we told him that everything was fine and that we could do that. I don't really think that my husband was thinking, but anyway, so that was the good news that they gave me, which I was extremely shocked and upset about the situation. But anyways, and it was just difficult to live now with my body feeling all these extra things in my body that were strange. So the sensations changed, and it was not something pleasant. So, days later, I got the results from the pathology laboratory, which informed that my tumor was HER2 positive, which was great news because, according to my doctor, in the past, this was one of the most aggressive and lethal types of cancer. However, now there is a targeted treatment, which is Herceptin, that is really improving the survival for these patients and the response, which is great news because this is going to be effective for you. So, they again confirmed that it was invasive ductal carcinoma. They removed also part of tissue from my right breast. However, that tissue came back negative. And again, this was extremely scary, something I was extremely worried that I could die on during my surgery and that it would be traumatic for my son to have his mom dying on the surgery. But I made it, and I was able to go back home and be with my kids. So then, in less than 2 weeks, actually 1 week after the surgery, I noticed that the skin in my wound was getting black. So it got necrotized. I had to have a second surgery, an urgent surgery again, 1 week after my surgery. And it seems that all the tissue around the tissue expander got necrotized. And it was extremely challenging, extremely difficult. Again, I was feeling threatened that something was threatening my life. I needed to have some therapy in an hyperbaric chamber to get oxygen and help my tissue heal. It was stressing to be there, but it did help. And as I was playing to be Snow White, I guess, I had to also kind of resolve what I was going to do with my chemotherapy. Something that I learned from my surgeon is that whenever you are living and treating a cancer, you have a window of 2 weeks where you have to make a decision and move quickly because cancer is growing. So anyways, I was having my oxygen therapy, but I needed to also identify what was going to be my next step, and hopefully in 10 days get my next step done. So I had a meeting. The next step was to identify a clinical oncologist to get the chemotherapy. So I got a meeting with 4 clinical oncologists, 2 in the private medicine in Mexico, 1 in the public health system, and another one from US. I wanted to hear from them what would be the treatment given the pathology results, what would be the treatment that they would provide me. Interestingly, the doctor that I saw in the public health system, he told me, I'm the one, I will give you the treatment that I consider is necessary for you. But he refused to give me any information about what treatment would look like. Certainly, I decided that he was not going to be my doctor. I simply couldn't work or let my life in his hands. So I was evaluating the other two doctors in the private system. And so basically they were proposing to have 4 cycles of anthracycline chemotherapy and 4 cycles of taxane, followed by 12 cycles of Herceptin. I was hesitant about if I should take adriamycin or epirubicin because those were the 2 options. And also, well, it was Taxol versus Taxotere. So anyways, I contacted a 4th oncologist. In this time was in USA. The doctor told me, well, that's any of those treatments are very effective. Some doctors have preferences related to the side effects for the drugs, but you should be very well covered with both of them. And interestingly, nobody in all of these 3 doctors plus other 3 doctors that I saw between surgeons and clinical oncologists, nobody told me anything about genetic testing and the fact that I was 36 years old and that I could have some genetic predisposition to cancer. But the oncologist in US, she immediately highlighted, super important for you to get genetic testing done. So anyways, I decided who was going to be my doctor in Mexico. So I picked for the doctor who was attending international conferences. For me, that was important because I wanted that person to trust that she knew everything that was needed to give me the best care. So I moved on with epirubicin plus cyclophosphamide, and then 4 cycles of Taxotere, and 12 cycles of Herceptin. And well, as I started to read and learn about genetic testing, well, I kind of considered that that was going to be important for my survival, and well, I could prioritize and leave it, investigate further after the chemotherapy. So moving on with my chemotherapy, I told you at the beginning of the presentation that my background is in pharmaceutical sciences. Well, it was not the exception for me to look at the labels of all my medication that I was going to receive. And I got extremely terrified just learning about all the toxicity to my heart, to my bone marrow, to neurotoxicity, etc., that I couldn't really believe that under my own will I was going to put myself in a bed to receive this treatment. So I was extremely fearful. And again, well, my kids were super young. I really wanted them to have a mom. So I talked to my husband and I told him, I don't think that I want to do this. I'm not going to do it. I went to see my doctor and I told her, I don't really like the side effects. What if I don't do chemo? What will happen? Or what if I only do Herceptin? How will that impact my survival? And, she said, well, we can do whatever you want. And I understand. So right now, well, the treatment has been kind of created and personalized for you based on your biomarkers in order to, well, decrease the chances for recurrence. With the surgery, I don't remember right now the right numbers, but she said with the surgery, we are reducing the chances for recurrence in 50, 60%. When we add Herceptin, we are reducing the chances in another 20%. So the chemotherapy, each one of the 4 cycles is going to give you 10 extra % of chances of reducing chances of recurrence. So, well, not having the chemo will be equivalent to having 20% more chances of recurrence. And well, that was super scary. My husband asked me, what would you do if one of our kids gets cancer? Would you give them chemo or not? That's when I said, well, I will. And then he said, would you mind please to take chemotherapy for us? And well, I accepted, but I was not really very happy about the decision. So anyways, I decided I'm going to move forward with the chemotherapy. And then, I was thinking I cannot be the only woman thinking or fearing about chemotherapy. So perhaps this is an opportunity for me to engage with other women in a support organization and learn from them how is that they are dealing with all these fears. So, and that's when I joined the first support organization. Interestingly, none of the women in the support organization had fears about the chemo. They actually referred to chemo as the holy liquid that enters and fills your body. And I told them, no, it's a poison, it's a bomb killing many of your cells. I don't know how happy they were of having me there, no? But eventually, well, we worked together, we understood each other, and actually I started to contribute to bringing that type of information to the support organization. Even thought that they thought that, well, chemo was a holy liquid, they said something important. They said that the red chemo was very aggressive and that would make you feel very bad. But the white chemo was an easy one and that was easy to tolerate and will not give you side effects. So I asked them, what do you mean with red chemo and white chemo? Is the box or the package, the label, or what are you referring to? And they said, it's the chemo. But again, so I couldn't understand. For me, I had epirubicin and I had Taxotere. I couldn't know which one was coming in a red or white box. It was until, well, I got my first chemotherapy, which again, unfortunately, they coincided, and my first chemo was on my little one's birthday, second birthday. And I was in the bed ready to receive the chemo when suddenly the nurse comes with a black plastic bag, and suddenly she puts the IV in the pole to start to give me the chemotherapy. And oh, surprise, it was wrong. So I was extremely shocked, extremely terrified. I wanted to remove the catheter. I wanted to run away. So the nurse had to tell me, like, well, you better calm down because if not, I'm going to cancel your chemo and then you will need to get another schedule. So anyways, I did what I could to calm myself down. And my husband actually, he brought my iPad with videos of my baby when he was born and all the beautiful things for me to focus on something different and be able to receive the chemotherapy. And well, as my friends in the support organization said, yes, as soon as the chemo finished, I was feeling so bad. I was feeling confused. I have headaches. I went to bed and I slept all the way from Thursday to Sunday, feeling so terrible. I suppose that I just had like my vital signs, but I couldn't really think clearly. What I remember is that I was waking like from time to time and checking myself at the mirror, just checking that I was not turning yellow, that I was not having a toxicity, because that was my biggest fear. But anyway, so nothing happened. I never turned yellow. And so when it was time to get my second chemotherapy, my doctor, like 1 week before, she ordered a blood test just to check my liver, all my organs, and also my blood count. Everything came back almost normal with my liver. However, my blood count was very low, that they had to postpone my second chemotherapy until I recovered my blood count. And well, this is how I identify myself every 21 days when I had to receive my red chemo. I felt that I was resuscitating every Sunday. I had 3 more cycles every 21 days. And then when I started to lose my hair, it actually hurt a lot that I had to shave my head. One of my very good friends, she recommended me to visit a psychiatrist and get some anxiety pills because I just couldn't really live with all the anxiety that the whole treatment was generating on me, besides, the cancer. So which I did, and I was very happy. I think that was something important because, I had to have 3 extra more chemotherapies, but I was able to better manage the situation and my anxiety. So then, I finally finished like all my 4 cycles and I went to see my doctor. I was really very excited. I was feeling victorious about, have finished like all my 4 cycles. I remember that I went to see the doctor in the afternoon by myself. My husband was working and traveling, so he was not there, but I told him, don't worry. So my friend said that the red one is the worst. So from here forward, I suppose that everything is going to be easier. And I'm talking to my doctor. Suddenly she says, well, congratulations on finishing your first cycles of chemotherapy. We will now initiate the most difficult part of the treatment. And I was like, what? What do you mean? So I started crying immediately. And I asked her, what was all of this then? If she said that we are just going to start the most difficult part, what is that? How is it going to look like? And again, well, I had fears, not that my life was in danger again, with the next treatment. But anyway, so again, the good thing is that I had my anxiety pills, so I started to take my treatment, the first cycle of Taxotere, and surprise, I finished the treatment. I didn't have headaches. I didn't feel dizzy. I was actually working after, well, I got my infusion because, well, something that also I wanted to share with you is that I decided to continue working. I didn't take clinical leave during my chemotherapy. It helped me to manage like all the anxiety. I remember that after having the first cycle of Taxotere, I was working that evening and I was having a dinner with my family. I didn't have any side effects until like 1 week later, where I had like muscle pain and my immune system came down. That's something that the doctor told me. I started bleeding on my gums. I well, many other side effects that you don't want to hear, but were terrifying. And well, for the second infusion, I go to the hospital. They just started to give me the infusion when I felt that all the veins in my body started to contract. I got a bronchospasm and I was having obviously difficulty breathing, chest pain. It was terrible. I thought that I may die. And again, well, my husband was traveling. I was alone with one of my friends. I told her as soon as I was able to recover to call and contact my family, which, well, my best friend and my sister came immediately as they could, but this was really terrifying. And well, something important here is that I had another meeting as a follow-up with my doctor, and we needed to decide if I was going to continue with the 2 remaining treatments or not. And again, well, all the statistical analysis about my chances of recurrence, etc., came to my mind, and I had to, well, make my most difficult decision in my whole life, if I should continue with the 2 remaining Taxotere infusions or not. I did a lot of surveys to a lot of people, and finally I decided that I would do it. I was thinking I didn't come all this way just to lose like 6% chances of, increasing my survival, so I decided to do it. And that morning, well, I kissed my kids. I told them, well, that I love them. I took many pictures. I was not sure if I was going to come back that day home. And then we went to the hospital. It was very stressful as they were preparing me. This time I got a special room. It was a kind of an emergency room with the crash cart and all the equipment ready for resuscitation in case I had like a more severe hypersensitivity reaction. And well, I had 2 nurses, my doctor, they were there close to me. They released 1 drop and they were just checking on me, my reaction. Nothing happened. Then they moved to 2nd, 3rd drop. And I was extremely lucky because I was able to finish my whole treatment, the whole infusion, without any reaction. Obviously, there was a preparation before the chemotherapy with more corticosteroids, more antihistaminics, and for sure that helped. And I was able to come back home that night with my kids. And I got my last infusion on December 12th that year. I didn't have any complications, which I was extremely lucky. I was my happiest day in my whole life, probably. And then, well, after that, I just needed to complete the extra 8 cycles of Herceptin, which I did and finished by August 11. And well, after that, well, I was back home with my kids, with my husband. It was super scary, but finally I made it. Well, because again, I was extremely anxious about recurrence. I asked my oncologist to order another PET CT scan for me. She said that's not the standard of care, that it has radiation, it's not good for you. And I told her, I don't care if that's a standard of care or no. I really want to see my body clean, no? So given the circumstances, she ordered another PET scan. Everything was clean. I was super happy. But then, every year I actually wanted to see that my body was clean. And obviously, well, you can imagine that when I got the results, it was very difficult to open the envelope and read the results. But every time that I read negative, everything fine, that was for me like you get a ticket to live one more year without concerns, no? So it became like I needed to do it, no? Well, I did it for 5 years, and then for the last 5 years of surveillance, I just got CT scan from time to time every 2 years. And well, I got in full remission in December 2022 when we were here in San Diego. And well, I still have pending like the genetic testing part. So once kind of I was done on that and I could focus on the next piece. So I was like thinking, okay, yes, based on the NCCN guidelines, since I am 36 years old, well, I should have a genetic testing and get my BRCA gene sequence and identify if I have mutations, because those mutations increase your risk of cancer, for breast cancer and ovarian cancer as well. And since I was keeping my right breast, I didn't know if I had like a time bomb in my body. So I was extremely concerned. So I started to look for a laboratory that was performing BRCA testing in Mexico. Unfortunately, I couldn't find any single lab. And I was selling sequencers. I checked with my customers in case anyone was doing a BRCA sequencing, even for research purposes, and I couldn't find any lab. So I decided together with my doctor that given the situation of my age and also the adenomas that we found on the right breast, that it would be better to do a second radical mastectomy, which, well, we did. And I was very happy with my decision and kind of feeling fine, that I was done with the cancer and that I could forget about cancer for the rest of my life. However, when I went back to the support organization, I remember my friend Candy. She was in her 20s and she had breast cancer and she didn't have any background in science. Hence, she didn't even know that she needed a genetic testing. So I felt bad. And I felt that as a scientist, it was my responsibility to do something, that it would be negligence on my part if I don't do anything knowing that that was happening. So that's kind of when I decided that I would start to work on around genetic testing, creating some campaigns. I was working again on a DNA company selling sequencers. I was organizing also marketing events, and I decided, well, perhaps we should start to work also from any angle on promoting genetic testing, creating awareness around the need of genetic testing in order to impact patients like Candy, who may need or may have a pathogenic variant. So I talked to my boss during that time. He was extremely supportive about the idea, about the plan. And then, while talking to one of my very best friends, who actually was very close to me during my whole cancer journey, and who was and is an expert in oncology. She worked on oncology projects during her bachelor's, master, PhD, postdoc, etc. And during that time, she was working for a pharmaceutical company. She was director for oncology. And I asked her, like, hey, do you know anyone who is doing BRCA testing that you would recommend? We need to bring that person and do, well, some training, some awareness, some collaboration here in Mexico. She said, well, I don't know anyone, but I will suggest you to go to AACR. In 2011, I decided I'm going to be there and find this expert that, I want to bring to Mexico to change the situation in the country. And this is me actually already in Orlando attending AACR, still wearing my scarf. And I was extremely lucky. I couldn't be actually luckier because during the conference, I attended a 7 a.m. conference about prevalence of BRCA testing mutations in Hispanic population in LA. And Dr. Whitesell was delivering that presentation. It was just amazing. It was the topic that I was looking for, and also in the population that I was looking for, which was amazing. And at the end of his presentation, I approached to him and I told him, as you can tell, I'm a breast cancer patient. I'm 36 years old. I didn't get genetic testing, and I'm fine. I made my own decisions, but other patients in Mexico don't have genetic testing and they are on risk, no? So I need you to help me to resolve the situation. I want to organize some seminars, some webinars, to increase awareness. And hopefully you can join me and share your experience with the health systems in Mexico. And he said, of course, count on me. I will do it. And actually, this picture is us in Mexico 1 month later after we met in AACR. He traveled with Dr. Kathy Blazer, who is a genetic counselor also at a City of Hope. So she's also a professor for cancer genomics education program. And super important, Dr. Weitzel was the director of the Department of Clinical Cancer Genetics at City of Hope. And they both had a wonderful program to train genetic counselors in US. And he came, we had several meetings with several authorities, several institutions involved on oncology. And we organized some, I organized some activities, campaigns to, targeted to scientific community, clinical community in order to create awareness. We invited him to speak, to share his research. And then we hosted different meetings with the different institutions. So Dr. Whitesell was able to collaborate to set some projects for a collaboration where the institutions will send the samples from many patients to his laboratory in City of Hope. He offered to perform the BRCA sequencing. He shared the results back to the different institutions, but not only that, he brought his whole team to train different clinical care providers on providing genetic counseling to the patients. This has been an amazing project. After Mexico, we decided to replicate the experience in Peru, in Colombia. We went to Brazil as well, different populations, different collaborations that he actually initiated with different groups. You can learn more about this beautiful project in this paper. And Dr. Whitesell so far and his team have provided genetic testing access to more than 6,000 patients in all Latin America, which is amazing. And obviously, I'm so proud that our paths crossed and that we were able to collaborate on enabling this project. With regards to my BRCA testing, I was not concerned again because I decided to have double mastectomy. However, when we were in Peru, when he handed me an envelope, and that envelope had my results from Myriad, he sent my sample to Myriad, and I confirmed that I was BRCA negative. Then when I moved to USA, I got a second genetic test. Many years later, this time was with Invite. They looked not only for BRCA, but for 50 genes to identify genetic susceptibility. It was negative as well. And obviously, after this project, that really gave me the passion to continue to leverage genomics to improve cancer patients. And I'm lucky that there are companies out there that have the same purpose and that I can continue to bring genomics to other places and help more patients. And well, with that, I just want to tell you that again, I am extremely fortunate. This is a picture from this last Sunday. Mateo turned 15. So it has been 15 years. I was just kind of asking for 10 more years, but well, I feel now finally happy. For a long time, I didn't buy things for me. I didn't buy clothes because I thought that I was going to die at some point. Eventually, I was able to manage those fears, and well, now I survived not only the cancer, but the surgery and the treatment. And I feel kind of back to normal. I'm very happy and lucky to be here celebrating with my kids. And well, I want to dedicate this presentation to Bryce, who I had the pleasure and really honored to meet and who inspired me with his life and his legacy. So thank you, Bryce. I think that is the reason why we are here together, why I met Brad. And so, well, really, thank you. We will continue with his legacy. And well, that's all my presentation. Thank you very much. And I think that we can open it to questions.
Thank you, Sandra. Yeah, if you could stop screen sharing, we can go to some questions from the group. So typically we use the raise hand feature if you have a question you want to voice, or you can put them in the chat. And just to get us started, Sandra, while you're doing that, Alan Morris had a question. After a double mastectomy, what have you been told about your risk for breast cancer? And he also asked, do your doctors or you consider yourself cured?
So I'm trying to stop my screen sharing. I don't see how.
There should be the share button along the bottom, maybe, and you can just do stop share.
I can, stop. Yes, perfect. Yeah. Okay. So yeah, the question, how do I feel after the second mastectomy and what my doctor said? So, well, I would say because, well, the second mastectomy and also, well, all the results, the genetic testing that I had, I feel back to normal. Like I feel like safe. I don't have fears. I thought that I would be able to manage these fears, but now finally I feel safe. I feel fine and I feel healthy.
Okay. Any other questions? David Plunkett, please.
Well, two questions have occurred to me. One is the anxiety that you described pre-treatment is understandable and I think very common. What advice do you give new patients to help deal with that?
Well, I will say that it's important to get psychological and some anxiety pills very early. Like, when I went to see my psychiatrist, he said, super important when you get diagnosed before going to find an oncologist, you need to find a psychiatrist. And, I kind of agreed with him because it was very hard for me. Again, I couldn't manage, even in the surgery, when I was feeling the strange bodies in my body, it was really crazy. So that would be my recommendation for newly diagnosed patients.
And then also, what advice have you given your children?
I feel lucky that they were very young. Obviously, it was so difficult, but there are things that they don't remember. Something that they remember is that they used to play with my prosthesis. They said that it was a ham breast or something like that. It was like a ball for them. But obviously, we have been kind of bringing things from the cancer story. I showed to Mateo yesterday. And so they know that, cancer could be really deadly and devastating. So what we do is we use sunblock, we try to eat healthy. So we do prevention, no? So that's kind of the message, that we need to take care and prevent cancer, because that's the best way to manage cancer, is by preventing it.
Okay. Marianne, you have your hand raised.
Yes, thank you. Could you talk about You talked about anxiety, but I'm curious if you experienced anxiety in the survivorship period upon completion of treatment, and how did that feel?
Yes, that is true. I think that that's a very strong fear that well, I will say I manage it better now, but it still is there. So, and obviously it's very difficult when you get fever or something and you go to the doctor, the first thing that they want to do is a CT scan or something, no? And I have had many of them, and obviously I get concerned, no? So basically, well, what I have been doing is kind of a lot of exercise, just taking care about what I'm eating, taking care that I'm sleeping well. I did have, for instance, another CT scan last year, no, because I was feeling fearful again. And something important, because indeed, yes, CT scans are not ideal. There is some radiation, there is no good. And here is another important piece, no, because we have been talking about genetic testing like all this time, no, during my presentation, and also pharmacogenetics. But there is a big need for having better methods to identify cancer, early detection cancer through DNA. So cancer is a disease of the genome, and we can see the disease in the genome, no? So I'm so happy that right now some tests for a minimal residual disease using whole genome sequencing are emerging. So actually, that's kind of what I'm planning, for my next years. Instead of having CT scan, have a minimal residual disease test, which is not toxic as the CT scan, but also it can predict cancer recurrence like a couple of years earlier before you can see it by imaging, which is really great, and another kind of opportunity to, well, bring access to better tools to identify cancer earlier.
Thank you very much.
Michael Liebman, I know you're struggling with the raised hand, but you're virtually, you've raised your hand. What would you like to say?
Two things. One is for clarification on the question about the double mastectomy and breast cancer. We were working with Mayo and working with the oncologic surgeons. It was a period when a number of women who did have risk factors, genetic risk factors, were opting for prophylactic mastectomies. And what the surgeons would tell you is it's a good preventative, but it's not a perfect preventative, because the breast tissue can be very much commingled with the chest wall. And so it's almost impossible to remove all of the breast tissue from the chest wall in a surgical procedure. So that's just something to keep in mind. So women who were getting double mastectomies, some of them were later on getting breast cancer, unfortunately. The other is I'm actually working with a brand new Cancer and Genomes Institute Center in Tijuana that's just opening up. It's open for business, but it's having a formal opening in July. And if you're interested in being connected with that, let me know and I can put you in touch with them directly.
Thank you very much, Michael. For sure, happy to be in contact with them as well.
Hey, let me build on that, Sandra. So you're in San Diego, which is one of the biotech centers of the world, and you've talked about your personal story, but a little bit less about your professional arc and how those two things intersected. Your personal experience influenced your professional interests and focus and some of the missions and passions you've had. So could you speak a little bit to that intermingling of your professional career and your advocacy for cancer?
Of course, thank you, Brad, for the question. So yes, I shared with you when I graduated, so I decided to work in genomics because that for me was a very exciting topic. So I actually I worked for Applied Biosystems Life Technologies that then became Thermo Fisher. I was there for 10 years. So Applied Biosystems was the company that provided the sequencers for sequencing the first human genome, which was exciting. I was super happy to work there. So again, well, my contribution to the oncology field was this last part that was like it really leveraging genomics to improve genetic testing. So after that, I moved in 2014 to San Diego. I was lucky to join the Illumina. So during my time at Illumina, I had also the privilege to work in the oncology teams. So I was in charge. That's what I wanted to do, by the way. So I wanted to continue to leverage genomics to improve cancer patient outcomes. So during that time, I was actually, my focus got broader because it was not only genetic testing and identifying, the mutations that could increase your risk to cancer, but I was also working heavily involved on comprehensive tumor profiling, all the therapy selection assays that are used in order to identify not in the germline genome, but in the somatic genome, what are the mutations that can be used as biomarkers to identify the best treatment. So that has been another area that is fascinating. And again, I have been lucky to be able to continue to bring back to patients through what I'm doing at work. So another of my projects was, more recently, I have been working a lot on liquid biopsy, identifying what are the different types of liquid biopsy. Liquid biopsy is emerging as the price of sequencing is decreasing. So it's now enabling to do whole genome sequencing, and also liquid biopsies as well, where you can do like heavy sequencing and identify variants at a very low representation that could be critical for determining best treatments, and also, in some cases, for determining minimal residual disease that we have been talking about. So obviously, I couldn't be luckier to be working in a place where I can leverage all of these genomic knowledge and tools to bring them back to improve the condition of cancer patients. So I'm extremely fortunate.
So building on that, Sandra in the chat says that she's your Tokaya, which I had to look up, but that means you have the same first name. Your story is inspiring, and I would love to replicate your genomic awareness journey, but with leukemia in Mexico after my diagnosis. Big hugs and regards. So can you speak to your experience looking at globally the differences between what you experience in healthcare in the United States, in Mexico, and in Latin America more broadly?
Yes, sure. I will say it's very, very different, even in Mexico itself, because, I shared with you my experience about going to the private health system and the public health system. So there are huge differences. So I will say that what I have seen, because, again, my career, my professional career has given me the opportunity to work with developing countries, other different than Mexico. And, I see that across like all the developing countries. Now there is a strong need to bring genomics. There is a strong need to bring it at a price point that can be implemented in those developing countries. I would say that's one of the similarities. So versus fully developed countries like US and some countries in Europe. So you will see that the diagnostic types of tests are not available, are different, are available, the cutting edge are available and already offered. And I can kind of bring the same example with BRCA testing, because in 2010, so there was no BRCA testing in Mexico, but it was already 15 years that it was available in US, no? And it's hard to say, but that continues to happen. And I was just thinking, even when the technologies are available, I think that there is a strong need for education to oncologists, education to patients. 5 years ago, another one of my friends got diagnosed in Mexico, and same situation. She never got recommended genetic testing. So I had to push her to go and get genetic testing. And unfortunately, she got an important mutation that needed special attention. But I think that programs like this one that Dr. Weitzel initiated with different institutions are key. They have proven that they can give access to other patients, and I think that we should really promote that collaboration.
Great. And just building on, I'm going to call on Phil in a moment, but just building on that, what is your vision for your work in the breast cancer community at the Cancer Patient Lab?
Well, I believe that there are already wonderful support organizations out there that are doing great things. I actually attended some support organizations during my years here in Mexico. I find differences versus what I had in Mexico. And again, I think that each one of them cover different purposes. I think that where we are in the Cancer Patient Lab, we can fulfill two goals. So one is to bridge patients that come to us to other support organizations for different types of needs that they may have, but we can also leverage the great technical team that we have here in order to share information, cutting edge information about what is happening out there in terms of new diagnostic methods and also new therapeutics, just to give them visibility about like all the different options that are emerging out there for them to make the best decisions and to improve their cancer patient outcomes. So I will say that is really, I think that we all know that a patient who empowers and gets involved is going to get better outcomes. I truly believe on that. And I think that what we can do here is to bring all of that information for other patients.
Thank you. Phil.
Hello, thank you. Hi, Sandra. I just wanted to find out with regards to your raising awareness. Obviously, it's very different in England with the NHS and our genomic testing that we do have available. And in that we have testing as standard of care. There is an eligibility criteria to have BRCA testing, but it is available. And one of my roles is about education of nurses, because we are mainstreaming genomic testing where we want nurses to be more empowered, have that knowledge in order to either signpost patients or to offer testing to patients. But I just wanted to find out what you think, or what other barriers do you have when you're talking to patients about genomic testing? What barriers are they encountering? Because quite rightly, as you say, it's about empowering patients. But if we empower patients, we also need to empower the healthcare professionals. So it's just to find out your thoughts on that.
Yeah, that's a very important question, because not all the patients are the same, I would say. In many cases, I actually invited patients to kind of learn more, etc. Some of them, they will say, no, I'm going to trust whatever my doctor tells me. And if they didn't recommend me genetic testing, it's perhaps because I don't need it. So I had like difficult or strong conversations with patients, giving them alternative scenarios where, perhaps they didn't offer it because they didn't know that this exists, So I actually, in some cases with my close friends, I had to push hard, for them to kind of open and really be receptive to all this new information. There are other patients that by themselves, they are going to go look around, connect with cancer support organizations, but again, not all the patients are the same. And how to convince those patients that they need to do something different. I think that is difficult. So I think that we should really provide the resources and make them available, but at the very end, it depends. A decision by the patient needs to happen as well. But we can be proactive and create information and put them at their hand to use it.
Thank you. Okay, I think we've hit the top of the hour. I will stop the recording. There we go.